Hello, everybody, and welcome to Life Positive, which is one of the newest shows on PromoHomo.TV. And I'm so excited about this series, which spotlights people living with, impacted by, or working to bring about the end of HIV and AIDS. And our guest today would fall into the latter category as someone who has been working personally and professionally, not only to bring about the end of HIV and AIDS, but also to really empower community health around sexuality and other issues. CJ Tobe is the Director of Community Health and Sexual Wellness Services at DAP Health, and he's passionate about eliminating barriers to allow everyone access to healthcare services. He started at DAP in 2015 as a medical case manager and has steadily earned the trust of senior leadership, fulfilling roles in clinic case management, prevention programs, management, and community health education and intervention management. He and I are both alumni, whatever you say in that case, of Arizona State University, and he is now involved in advanced educational pursuits, which we'll get into. I describe him, my words, as someone who walks his talk because he's very integrated and authentic however he shows up in the world. There's no compartmentalization about CJ. And I just love it when people in our community who do this work are just so authentic and honest across the board in all spaces. So CJ is definitely coming up in the show. You're going to want to stay tuned for that. And I'm just very excited. Paul Jasek is a wonderful friend of mine. He's also a long-term survivor. He's celebrating the end of AIDS. And yes, the end of AIDS is in sight, Paul. And I'm so glad you and I are both here to talk about it. I am living powerfully with HIV. Speaking of which, for their support of my show, I want to thank DAP Health. One of their value statements is, "We welcome all people, period." And I'm broadcasting live from my home studio in the affordable housing complex affiliated with DAP. I also want to give a shout out to 849 Restaurant and Lounge on North Palm Canyon. Love them. Love Willie Ryan and John Pascal, the owners. I'm a proud media sponsor of the LGBT Community Center of the Desert. Their motto, their mission, creating a vibrant community by helping LGBTQ people along their way. This broadcast is coming out to you live on February 14th, 2022. The center's Red Dress Red tickets go on sale Wednesday morning at this website. If you see this in time and you want to get those coveted tickets, go there now to find out how. I'm a proud media sponsor of Palm Springs Pride. The big event is November, but you can find 4 complete Pride parades at PromoHomo.TV. And for their support in amplifying my show, my network across the Twitterverse, I want to thank the hashtag I Love Gay campaign, and of course media partners KK1065 Palm Springs, the hashtag I Love Gay Palm Springs podcast, and gaydesertguide.lgbt. If you're having t-shirt envy, no need, because you can get a PromoHomo.TV merch from the merch link at the website, or go to Amazon and search official PromoHomo.TV. If you're watching on YouTube, hit the subscribe button. If you are watching on Facebook during the broadcast, a bell symbol will pop up and you can click on it to be reminded of future broadcasts. And by all means, follow me on social to stay in the know about where PromoHomo.TV is going to go. One of the ways this network becomes possible is through the support of the PromoHomo.TV superstars. And I'm throwing a big subscriber thank you party and 60th birthday party on Sunday, April 24th, specifically for people who voluntarily subscribe to PromoHomo.TV. The network is free, but you can support the network for as little as $10 a month. And here is a shout out to the people that are doing just that. And CJ is coming up as promised, but I wanted to let you know that if you're watching live on February 14th, happy Valentine's, by the way, and in the social media contents, you type in hashtag DAP Health, that's today's hashtag. I'm going to do a giveaway for the official PromoHomo.TV sticker at the end of the show. But that's if you type the hashtag DAP Health. And I do know if you're watching on LinkedIn, it may not work. You have to be watching on YouTube or Facebook to participate in that giveaway today. The LinkedIn is having some technical issues. So without further delay, let me welcome to the show CJ Tobe. Hi, CJ.
Good morning. Happy Valentine's Day and early 60th birthday to you.
Well, thank you so much. You know, another thing that they call Valentine's Day, right?
Singles Awareness Day.
Yes, Singles Awareness Day. You got it. You got it. Yes. Well, you know, that's life. I'm happy to be single. I'm happy to be anywhere, frankly. So, one of the things I want to talk about right off the bat is I'm literally sitting 5 minutes from any appointment I would ever need to have at DAP Health. But one of the exciting things that is happening is that DAP Health is opening a sexual health and wellness clinic in Indio. And I think it's important to talk about some information that DAP Health just released. In 2019, 25% of all HIV positive test results at DAP Health were Hispanic men. And you said many folks were driving from the East Valley to Palm Springs to utilize DAP Health's sexual wellness services. We noticed not only a high volume of patients, but most of these patients were already having symptoms of an STI or testing positive for HIV. And that's why that you and your team and DAP are so passionate about expanding those services. First of all, congratulations and thank you. And secondly, what would you like to say about that?
Well, I want to say that opening a clinic in Indio related to sexual wellness is going to be a major win for the community in the East Valley. And there's so much data that supports why a free sexual wellness clinic needs to be open really in the heart of the Latino community in the Coachella Valley. We know that people who are Latino are still most impacted by HIV. And we have a beautiful campus here in Palm Springs, which is going to be 30 minutes from that new clinic in Indio. But it's health equity, right? So we know people aren't going to drive 30 minutes to come access those needed services for sexual wellness. So what do we do? Well, we're going to open up a clinic right in their neighborhood and say, come see us and let us care for you.
That's wonderful. By the way, Paul, who has tried to enter our giveaway, it's hashtag DAP Health has to be all one word. So enter again. Paul says, hi, CJ. And he also says, happy Valentine's Day. You know, the center, the LGBTQ Community Center of the Desert, just opened a new center in Coachella, right in downtown Coachella, which is just, it's really spectacular. One of the things that all of us are more aware of, at least I am, is the notion of privilege, especially white cis male privilege. And I know that DAP Health really looks deeply at these issues. And I was wondering if you would speak from your own personal perspective and from the agency's perspective about how you are really seeking to perhaps identify any shortcomings that may have existed in terms of serving particular populations and really stepping up to the plate to do so.
Well, I would say the biggest change, and I feel call to action that I feel that we do, is a lot of people think leaders or leadership is about taking action and moving things forward and making decisions. But when you start looking at privilege and you look at health equity and trying to serve a community that you may not identify yourself, we have to do more listening. We have to let anything that we do come from within those communities that we're trying to reach and serve. So they talk to us about where the needs are. They talk to us about what programs and services do they need and how to go about doing that. So it's really about more listening and getting more representation within all the communities that are impacted by HIV or just health disparities in general.
Well, I am just so grateful that I am a client of DAP. They are an advertiser of my show, and they have been for decades, full disclosure. But this is not an infomercial. I was doing journalism about these issues long before I began to need DAP as a client, and I really appreciate their support. You know, one of the things that was a part of my life in the Phoenix area in the early 80s when I was coming out. And then the bulk of the time I lived in LA was a free clinic, a place to go for free HIV and STI and other testing and treatment. And until recently, there wasn't a free clinic option that I knew of for those services. But once again, DAP is stepping up. And I would love for you to talk about that particular expansion, not only into Indio, but right here on the main campus.
So before the pandemic, DEP Health, we went into 3-year business planning through a consultant for all of our clinics. And David Lee, the nursing manager here at DEP, and myself co-chaired the business planning for sexual wellness services. And so what we've done through the pandemic, really, and moving forward, is implementing that business plan. It's not like we woke up one day and said, you know, let's open up a clinic, let's make sexual wellness services free, and let's partner and do virtual PrEP throughout the entire state of California. It was all part of a planning process. And so we let data, right, drive the decision making. We let the community say, hey, we need this. And so to give you some historical context, especially to your viewers that may not be familiar with everything, we opened a sexual wellness clinic back in 2015 here at DAP. And over the last 6 years, we went through billing insurance, charging $125, charging $25. But through this planning, we saw that over 50% of new HIV cases were people that were making $17,000 a year or less. So we knew even $25 was going to prevent some people from coming in to the sexual wellness clinic and access those life-changing sexual wellness services, whether it was testing, whether it was PrEP. And so in July of 2021, we made the decision to make all sexual wellness services free. And since then, we've already seen over 2,000 patients in the first 6 months. And we've started more people on PrEP in the first 4 months after making services free than we did the whole previous year. So the community is definitely embracing and responding to having free access to sexual wellness services.
And how do people access those services?
Well, they can walk in to the DAP Health Orange Clinic. When you come to our campus, there'll be signage. You can go to daphealth.org and click the sexual wellness tab and inquire that way. And you can also call us too at 760-992-0492 to make an appointment. And we do accept walk-ins based on availability.
So in the last 2 to 3 years, DAP has grown a tremendous amount. Well, it keeps growing. It's evolved over the decades. And because of the glorious breakthroughs that exist in the fight against HIV and AIDS, those of us living with HIV are getting older, and we need a broad variety of care that is more relevant to our age rather than our HIV status. But also, DAP became really powerful in addressing underserved communities, and then became a federally qualified health center, FQHC. Is that the correct term?
That's correct.
All right. And the result of that is, I think 3/4 of your clientele now, the people that you serve, are not living with HIV, but instead they're accessing a whole broad array of health and well-being services. Have I articulated all this correctly?
That was beautiful.
All right. So I'm living with HIV, but I'm going to DAP for all these other issues. My HIV is fabulously under control, and I'm living powerfully and undetectably. But many in the community, they don't. Some people, not many, but some people in the community feel like DAP is leaving people behind, but that's not true. That's not true. I mean, they maintained DAP as part of the new title, DAP Health. And in telling of the story of the DAP, it's always rooted in the response to the HIV/AIDS epidemic and the great loss and the tremendous courage that was at the forefront of the birth of this organization. So I always just like to make the point, as someone that's accessing services, the reason I access it now is less related to the fact that I'm living with HIV, but more so for everything else that I need. What would you like to add to that?
Well, what I would add to that, because we did do a rebranding from Desert AIDS Project to DAP Health last 2021. And the way I look at this, and again, as you saw, Arizona State, right, alumni, is I was a history major. And so I look at 1984, this organization was founded through the AIDS crisis. And through the first 2 decades, we've seen that wraparound vital services to care for someone living with HIV should expand, right? And so it was the organization's decision, yes, to become that FQHC, to receive federal designation where we could expand our mission, take what we've learned through the AIDS crisis, the model of wraparound vital health services, and give it to the broader community, because anybody that walks into our doors are going to benefit from behavioral health, dental care, an on-site pharmacy and lab. It's regardless of HIV status. And so I think with the brand evolution, evolving into DAB Health, and yes, 75% of our patients are now non-HIV, anybody can benefit from DAB Health services regardless of HIV status.
I happen to have. I've been invited to give a client's perspective at the upcoming dedication of the Annette Block Care Building. Annette Block gave millions of dollars to DAP. But in preparation for my talk, I was looking at specific aspects of what it's like for me living on this campus. And on Wednesday, December 29th, I accessed a COVID test via a nurse visit at the Green Clinic after traveling for the holidays. On Saturday, January 8th, I picked up a box of groceries just next to my building as the result of DAP's monthly collaboration with Find Food Bank. On February 4th, I went to LabCorp inside the Barbara Keller Love Building for my blood draw in preparation for my routine follow-up appointment with my primary care physician, Dr. David Morris. On February 9th, I had my annual visit with Dr. Daniel Joe in the dental clinic and scheduled my biannual cleaning. The next day, I saw Dr. Morris in the Green Clinic to review the consistently fabulous results of my blood panel. And I do have a car now, but I didn't need a car to go to any of those. My maximum commute time was 5 minutes of casual strolling.
And Nicholas, you did all of that walking across an alley to get to your medical home. Isn't that beautiful?
Yes. And now you're providing more access in the East Valley. One of the things that I kind of wish I'd gotten to this topic earlier in the broadcast, but you have launched, and DAP Health has launched a really important harm reduction initiative. And you're confronting the opioid crisis as part of that. So I'd love for you to just give an overview of the new harm reduction focus and the aspects of it, and more importantly, how people access those services if they need them.
Absolutely. So DAP Health is starting a harm reduction program, and there's two components to that program. The first one is overdose prevention, where we've already started distributing Narcan out of our mobile clinic throughout the community. And so what Narcan does is it's a nasal spray to where if we see someone who's experiencing overdose, this nasal spray will reverse that overdose and prevent someone from dying. And the reason why this is so important is because in Palm Springs, we identified through the pandemic that over 300% death rate caused to overdose was higher than the entire state average. So looking at that data, we knew we needed to respond immediately, and we started distributing Narcan out of the mobile clinic. The second component is called a syringe service program, which I'm sure many viewers know it as a needle exchange program. And I think one of the main important things to talk about a Syringe Service Program is it's not new. They've been around since 1989. There's nearly 450 nationally, 40 in the state of California, and we will be the second one here in Riverside County when we officially launch that program in April. And I know you may have some questions about, well, what does a Syringe Service Program look like? So the Syringe Service Program will be operating out of the mobile clinic only in the city of Palm Springs, 24 hours a week. And it will be a place where people who are using drugs can access services. So they'll bring in their used syringes, we'll dispose of them, we'll keep them off the street, we'll prevent accidental needle sticks, and then we'll give them new equipment. And the reason why it's such a big deal when you talk about HIV and hepatitis C transmission is a lot of folks will share their used drug equipment. And that's how HIV and hep C is transmitted as well outside of sex. And so when we did internal data and business planning, we saw that 1 in 5 of our new HIV cases actually reported substance use at the time of diagnosis. And so we internally felt this was a needed program right now more than ever, and a missing piece to ending the HIV epidemic in our region. And so we received state authorization on January 10th to provide this Syringe Service Program in the city of Palm Springs. And on top of that program and those services that I just mentioned, we're going to have conversations with people entering the mobile clinic about, what do you need from us today? Would you like insurance and see primary care? Maybe they're ready to stop right now and they don't want to use drugs anymore. And we're going to connect them to either a peer support specialist, a licensed substance use counselor, or get them into a recovery center that we have over a dozen partners with. So the journey with addiction is going to look differently for everybody that comes into the mobile clinic. But what we'll be sure to do is we're going to greet them with a smile, and we're going to listen to them, and we're going to provide and support them without stigma and shame, and help support them with anything they need.
That's really very powerful. Congratulations on that program. When we were talking about the free clinic aspects of what you're doing earlier, we briefly mentioned PEP and PrEP. I can really easily explain what those are, but that's your job. So why don't you talk about what PEP and PrEP are and their relationship to bringing about the end of HIV and AIDS, and also your new collaboration with Mr. in the state of California.
So PrEP, a lot of people refer PrEP to the morning after pill for a woman who does not want to get pregnant. And so PrEP is a pill that someone takes once a day who's HIV negative, and then they remain HIV negative. And then PEP would be for somebody who is HIV negative that may have had an accidental needle stick or a sexual encounter and may have been exposed to HIV. They then would take PEP for the next 28 days to remain HIV negative. And
so PrEP stands for pre-exposure prophylaxis, and PEP stands for post-exposure prophylaxis.
You got it. And then the important thing about PEP would be that after that potential HIV exposure is to make sure that you seek medical care and start taking the PEP post-exposure prophylaxis medication within 72 hours of that exposure. So there is a timeline with PEP that is really important to know.
Certainly. And now people can access PEP and PrEP. They don't even have to be seen in person, correct?
That is correct. So they can be seen virtually. And really through the pandemic, we really looked at what services, outside of primary care, HIV care, could we actually offer virtually. And so in November of last year, we decided to partner with Mr., which is a virtual PrEP platform that's doing virtual PrEP across the nation. And they partner with FQHCs, or community-based organizations, to really bring about the full range of virtual PrEP. And so I'm happy to share with you, we've actually enrolled over 500 virtual PrEP patients since November 26th. And I'll share a story with you that actually happened the first week of January, where we had somebody living about 50 minutes from Palm Springs who went through clicking an app, right? I think they were on Grindr. They see the Mr. ad pop up, they click it, and they say, you know what, I want PrEP shipped to my house. I want to see a doctor. I'm going to do all the lab work at home. Well, their test came back that they were actually HIV positive. So the virtual PrEP intention turned into a life-changing HIV diagnosis. And within 5 days of that patient clicking that app for virtual PrEP, we were able to get them transportation and be seen here at DAP Health in the Orange Clinic to begin rapid start HIV medication.
I'm getting goosebumps at that story. I became HIV positive in 2007, and I was living outside the US. And in that country at that time, they didn't start people on antiretrovirals until your T cell count dropped below 500. Of course, the science has changed, and as soon as we know someone, the healthcare providers know that someone is HIV positive, they put them on antiretroviral medications because generally within weeks or a month of doing that, the person living with HIV develops what they refer to as an undetectable viral load. And even though the scientific community knew this for a long time, now they can legitimately say, because of all of the trials, all of the treatment, all of the research, that someone with an undetectable viral load is scientifically unable to transmit HIV.
That's correct. And Nicholas, on top of that, on why U equals U, undetectable equals untransmittable is so important, is it stops transmission of HIV. It also reduces the stigma and shame with somebody with HIV, knowing that if they see their doctor, take their medication, and remain undetectable, that they cannot transmit HIV. And so DAP Health, I'll share this with you. We are national recipients through HRSA and UCSF of a Rapid Start program, and we just started year 2 of that. And so what it's allowed us to do is, as I just mentioned, a newly diagnosed patient with HIV is able to come into our clinic and get medication right away. Well, that's the same for anybody who may have fallen out of care, or somebody who moves to Palm Springs from, let's say, the East Coast, or maybe it's somebody that tested positive 3 years ago and they're still coping with their new HIV diagnosis. This Rapid Start program at DAP Health is for anybody with HIV that can walk in our doors and they will get medication within 7 days.
That's amazing. That's just amazing. And it's so helpful when someone learns that they are HIV positive. I speak from personal experience, to have support on so many different levels, especially emotionally. I'm going to take a quick break and come back, and you and I are going to talk about the apps like Grinder.
Great.
But I want to say that only Paul has entered our contest, so it's going to be an easy win for him if no one else wants to enter. Most of my programming is watched after the fact and not live, especially because I was on hiatus preparing for this new and very busy season. And now that it's up and running, I've actually decided I'm moving into prime time within the next couple of weeks. So my shows will be more accessible to an immediate live audience, which I'm looking forward to. But in my new show, the Nicholas Snow Show in particular, I'm going to be featuring this. And one of our mutual friends, CJ, is saying hello, Sandy McLaughlin, in Telluride. She does not want to enter the contest, but she's saying hello.
Hi, Sandy.
I ended up knowing Sandy because she was close friends with my late great brother Felix, and was really involved with his life at the end. And I have a deep place in my heart for Sandy. So, and she says that she misses us both. I was actually thinking about you, Sandy, before we went on air, and I'm so glad that you tuned in. So, I want to talk to you about Grindr. So, I have my phone, and I'm opening up my Grindr app, and I am looking at my own profile. And one of the things I talked about at the beginning of the show was the fact that I appreciate you for your transparency and your authenticity, and the fact that you do not compartmentalize your life, because I see you in these spaces. And I just love it when people are authentically themselves in these particular spaces. One of the reasons, though, that I know that there is still a lot of stigma against those of us living with HIV is because I've experimented in these environments about whether or not to disclose my HIV status right up front or wait. And anytime I have waited, I get tons and tons more interest. And when I express that I'm HIV positive undetectable in the app, that is when one of the reasons that I get very little interest in the app. So, what would you like to say about these apps and the relationship with the sort of forever to be here relationship with the apps and the gay male community, and the importance of being open and honest in those environments to preserve people's health and well-being?
Well, I first think it's important to go back to the power is actually with us, right? Whether we're living with HIV or we're HIV negative, whatever it may look like, the power's with us. So we can disclose our status to whomever we want to, whenever we want to, and however we want to. So we shouldn't let an app really dictate how we disclose our status, what we talk about, how often we're on the app, or who we meet. So I think that's something that's really important. Is the power is ours, so we can make that choice on what we want to do with it. But on a personal level, I'll definitely share with you. I've had the same reaction from the community, just like you. And this is regardless of where I've been in the country. You could post your HIV status in your profile, and you may not get as many messages as you would if you just leave it completely blank. And there's been some people where if you would disclose your HIV status, you say 2 months into just chatting with them, not even meeting them, they get extremely upset that you didn't disclose it right away. And so I really wouldn't let other people dictate to how you deliver your message, because it's your message. It's your story to share with whomever you want to and whenever you want to do it. And so that would be my take on it. And again, that's just my personal take.
Well, certainly. And, I know from personal experience, I think that isolation, loneliness, and depression were part of the reason that I became HIV positive. But also, one of the factors was I was with someone who said and believed he said and or believed, I believe that he believed that he was HIV negative. And one of the key points that I want to make is that if someone in this environment isn't disclosing an HIV status, or even if they're identifying themselves as negative, they very well might be HIV positive and either know it and they're not telling you, or they don't know it. And I would love for you to talk about the percentages of people with HIV in the men who have sex with men community that don't know they're HIV positive.
Well, I mean, there's 1 in 2 people that are living with HIV right now who don't know they actually have HIV. And you look at dating in 2022 while we're, finally going down the latest surge of COVID, and you start thinking, well, what does 2022 dating look like as a single gay man in Palm Springs or Southern California? And you start looking at your sexual wellness, and you start looking about, well, when was the last time you've tested? Are you taking your PrEP medication daily? Are you taking your HIV medication daily? It's going to look differently for everybody. But yes, I've encountered many people who will say, well, I don't want to have sex with you because you have the HIV. Even though you are undetectable and I know you can't pass it, I still don't believe the science behind it. Or, well, what if you missed 1 dose, right? And so then it comes into, it's not really a social setting, it's more so it turns into education. That actually somebody with HIV could, miss 3 or 4 doses a month and actually still remain undetectable and not pass HIV. And there are many folks that may be living with HIV that don't know it, and they're not on PrEP. And again, when you select your status on an app, there are people that will select that they are on PrEP and they're not, or maybe they've stopped and just haven't updated it. And the same thing goes with somebody with HIV as well. So I'm a big believer in this. I'm a big believer in taking care of yourself. So if you're in a monogamous relationship, regardless of how monogamous you think you are, if you are having unprotected or condomless sex and you want to control everything you can about your body, you should look at getting on PrEP. You should get tested every 3 months. And that goes across the spectrum, is routinely testing, having open conversations, and doing what you can control, which is take control of your sexual health. Come see us at the Orange Clinic, get your PrEP virtually, come to our Rapid Start program in the Orange Clinic, control what you can, and then continue to have those conversations with people, because that's how you're going to educate, and you're also going to learn through that process as well.
Well, CJ, I appreciate your honesty, your candidness, your vibrancy and passion that you bring to your work. I'm grateful that I have come to know you and call you friend. Is there anything you'd like to add to our discussion today, either in review or that we haven't talked about?
The one thing I'll just add would be one, thank you for having me again, talk about GAP health. It's becoming my favorite thing to do. It's a hobby. To just talk about the wonderful work we're doing, and the fact that we've made sexual wellness services free in the Orange Clinic, that we provided virtual PrEP to over 500 people across the state in the last couple months, that we're launching a needed harm reduction program that's going to save lives and connect more people to medical and social support services, and opening a free DAP Health NPO clinic with sexual wellness services come June. It's absolutely overwhelming, and I'm so excited that the community has spoken and said we need these services and that we're here to deliver as DAP Health, but also with all the amazing partners that we've obviously had over our 37 years as an organization.
I'm speechless, and you're starting to sound like me. You speak in sound bites, but very passionately. I loved everything that you had to say, and to recap our conversation, and I appreciate that all that you do, and you're welcome on the show anytime.
Thank you. I'll come back anytime you ask.
Thank you. Hang tight. I'll speak with you in just a minute. And for those of you who have been watching, thank you so much, and I'll see you next time.